Well, hello, everyone. Welcome back to another episode of the Doctors Changing Medicine podcast. I have Dr. Christine Gibson here, and she is joining us from Canada. And
I-
is your mom in
a
Canada?
Yes, and it's a very snowy day, so you're getting a very typical Canadian landscape when I look out the window.
Oh my goodness. Okay, so it is I don't know what it is. It's probably like 65, 70 degrees here, but I live in Hotlanta, so what can I say? So, welcome to the show. I'm so excited to have you here.
Yeah, I'm really excited to be here.
Awesome. So you are family medicine by training, and you do a lot of other things. So I'm going to give you a moment to introduce yourself to the listeners, let them understand why I'm so excited you're on the show today.
Thank you. So I've had a very varied career. I started as a hospitalist and then I moved into community family practice. And I did a master's in medical education when I was doing international work. And then I created an international nonprofit, been running that for 10 years. We support primary care overseas, Global Family Med Foundation. I created our health equity residency as a part of my master's, and I was program director for 6 years. And in equity deserving communities, trauma is the underlying root of a lot of medical and physical, medical and mental conditions. And we don't get given a lot of tools for that as physicians. So I began training as a trauma therapist. So I've been doing probably 70% trauma therapy, 30% family medicine recently in adult addictions and refugee. I started putting out social media content around mental health and trauma, which blew up on TikTok as TikTok Trauma Doc, which led to a book. The Modern Trauma Toolkit came out last year. A company, which is called Safer Spaces Training, which trains workplaces for psychological safety. And as of Sunday, I submitted my doctoral revision. So I'm now a double doctor. I just finished a doctorate in professional studies by Public Works in transdisciplinary study.
Golly, woman, how many lives are you living at one time? And I
Well, I
thought,
mean, I joke with people, but I think it is partially true is I didn't have kids. So all the time that a lot of people spend parenting, the book is my baby and the residency program is my baby. And I definitely have social relationships with young people and a niece and a nephew, but it does free up a lot of time not to be parenting.
well, even looking at it that way, you have a lot of babies. That's a lot of them. Okay, so my question to you is, what is the why that is driving this, right? Because for somebody to do this much for this long and be the double doctor and write the books and be prolific on social media and start a residency pro and do all of these things and say, oh yeah, the underlying thing is trauma, so I'm going to become a trauma therapist. Like there is a driver, right? So what is it? Tell me a little bit about that.
Well, you're asking at the perfect time because a lot of the doctoral work was autoethnography of my own career. So like what is my motivating kind of factors and how do I see the work in the greater scheme of things? So like in looking into the past, I can see I was drawn to equity deserving communities, I think because of my background. There was trauma in the family background, including cultural trauma. Like we were Scottish and Ukrainian. And
Mm.
until I really started to understand, oppression in global scales, I didn't understand that even a white person can have a culture of oppression. And both of those cultures have undergone many um, attempted genocide of their culture, language, and I didn't see myself in that light until I started studying a little bit more about what it meant to be um, from my cultural background in particular, and not just a white person, but a white person of Scottish and Ukrainian origin. I've been thinking about why I'm drawn to equity deserving communities in terms of their specific needs. Um, and so my second TED Talk is going to be in June, and the overall subject is how our non-response to the climate emergency is actually trauma. It's dissociative, and it needs the same response that trauma therapy would give. And I honestly think that there's something really unique about the times we're living in right now between social media, the climate emergency, polarization, rampant inequity that's causing most problems. And I do think I have some unique skills and gifts and insights to serve in these times. So that's kind of the future thinking.
Man, okay. So along this journey, because it's a very spectacular journey, have you had any challenges, or has this been a smooth sailing? Like, oh, I'm going to do this, and 6 months later it's done. I'm going to do this, and a year later it's done, right? Like everything is just falling into place. Have there been challenges, and if there have been, what have they been? You can give us some examples, and how did you overcome them? Because clearly there's no stopping you.
Well, there has been stopping me, Lord. Um, personally and professionally, I've had many obstacles. So one of the main factors in helping me understand trauma as underlying so much of our um, conditions that we see in front of us was having undergone some, not PTSD, but certainly PTS symptoms from being caught in Nepal in the earthquakes in 2015. So my nonprofit brought me to working in the Kathmandu Valley. I was working with a medical school that does incredible social accountability, and the earthquakes hit. So I didn't go there to try to be, of any kind of public service. I just happened to be there and waited to get evacuated along with the other Westerners. And that was really eye-opening to me, both in terms of my own physical experience of trauma and the triggers that were pretty alive for 2 or 3 years before I started to really jump into trauma work. Um, I mean, lots of other personal traumas, a very awful divorce and losing some close family members. And I started to recognize just how ubiquitous this is. Like all of us face traumatic experience, and depending on our genetic makeup and social conditioning, our context, we may experience stuck feelings of trauma. And as physicians, we have this opportunity to both be more acknowledging of it and managing it. And we just aren't trained in that way. So I'm really hoping that more people learn just a few skills. So even though my book, The Modern Trauma Toolkit, was designed for lay people, I'm hoping that because of the journey that I had to go on, I'm hoping that people can take a shortcut and say, hey, what are the few skills I could do in my office? So I think of all of this as post-traumatic growth. So even though there's these big challenges that we've all overcome, what does it look like to come out on the other side of it? I also formed a cooperative at the beginning of the pandemic that really blew up. So the co-op was not the right model for what we wanted to do. The board was not the right fit. There were just so many things that went horribly wrong. Um, I think of this, one of my chapters in my doctoral dissertation was using the adaptive cycle from social innovation, how things try to reach a conservation phase, and yet they do release and they fall apart and have to reorganize. And I try to think of all of these failures as generative. Like, what is the next thing that's going to form from the ashes of the thing that's falling apart?
And that's such a powerful way to look at, and I'm using air quotes like you, failure, right? It's like, how is it a gift? How is this disadvantage an advantage? How is this, what will come out of this? If I can um, go through the storm using some of the skills you're gonna tell us about, where we go find it in the book, but if I use those, then how can I look back and say, oh my goodness, I hope nobody ever goes through that, but I wouldn't change a thing. You know what I mean? Like, how does that happen? So talk to us a little bit about the book. Like, you can give us some nuggets. Don't give us a lot of nuggets because we have to go get the book, right? But if you're like, okay, you'll learn this skill from my book, or there's this tool that I want everybody to use, you can talk about that and then tell us where we can find the book.
So the Modern Trauma Toolkit is a way to help patients understand toxic stress and their physiologic response to it with a solution focus. So the tagline is nurturing your path to post-traumatic growth. And it's written at a grade 8 level with very accessible language. So I didn't read it with clinicians in mind. That being said, the bulk of the content are not things I learned in medical school. So I have whole chapters on somatic skills, things like havening, tapping, tremoring, things that our body is uniquely able to do, but we've been socially conditioned to go away from our ancestral tendencies. Like we've had so many forgotten healing skills. Our ancestors used to chant, they used to circle dance, they used to grieve in community, they used to have rituals. We used to tremor. That the kinds of things that the human body and the communities are capable of, I honestly think we have to go back to what was built in because Ativan does not fix trauma. um, Psychedelic mushrooms, maybe a little bit, but we just don't have the tools that we're used to in medicine, and we have to really go back and figure those out. What does the body already know? So I'm really encouraging doctors to learn those skills because not only can we regulate our own emotions better, but we can teach these skills in a minute or two in our office practices. And the other thing that I did in my book that I think is quite unique is I focused on system level solutions. So, how do you run a social innovation lab? What policies are supportive of the things that cause trauma, like racism and inequity and, um, not having your foundational needs met? That's pretty traumatic, and that's definitely getting worse in our society. So, how can we address structural trauma as well? I think you can't talk about trauma without talking about systems.
So this is really fascinating to me. Like the fact that you do this all the way at the patient level, all the way up to, I dare say, a global level, and all of that, because you're touching the whole spectrum, right? Tell me when you think about the next 12 months, the next, you know, 12 months, we can keep it at that. What do you see as far as your impact or how all of this plays out? I know you have another TED Talk coming up and all of that, but what do you see? Share your vision with us.
I'm super deliberate, Dr. Una. Like when I kind of mapped my career and I took a residency, and we think of, residency from a medical perspective, but this was more like an artist residency and it was in social innovation. So how do you change large systems and be a systems entrepreneur? And one of the things that I was taught is that we aren't using our privilege and our credentials sufficiently to address all of the leverage points that are available to us. And so one of the reasons I blew up in social media is because I am a double doctor. And one of the reasons why I can get speaking engagements is because I have this credibility, and all of us have this capacity. So as much as we can, I really do think that leveraging every area where you have a network and where you have a platform is what I encourage people to do. So, um, my next step is to really push the company Safer Spaces training. I want us to have online platforms where we can do psychological safety, psychological first aid, nonviolent communication. We're actually revamping that for more modern language. And just imagine if all self-regulating professionals understood trauma in their own bodies and in the public, including physicians. Many of us are not trauma informed. So now that people are more expressive of their emotions post-pandemic, we're seeing a lot more fight, flight, and freeze in the public. I just want the public to have a greater understanding of what to do about it. So I think the company will be my next area of focus in the next 12 months and hopefully getting more speaking engagements. I love doing speaking because you can see the little light bulbs come on, and I'll get emails afterwards saying, "Oh my gosh, like this one idea made such a big difference." So I love that.
I love speaking too. And are you an introvert or an extrovert or
It's
both?
such a fun question. I would have said extrovert up until the pandemic, but I've really kind of enjoyed being more of a homebody for a couple of years. So I would say I can be both. When the time calls for it, I can be quite outgoing and the organizing things and getting people outside and doing stuff. And then I can hunker down and recharge.
Okay, there you go. Well, you and I are probably really similar, but I started off as a very introverted introvert. So, um, you said something super powerful. I want to make sure that people hang on to, and that is taking your privilege, all the privilege, and I don't know if privilege is the word you used, but all of it, and leveraging it to help people. Like use all of it. We have it. So you talked about, how being a double doctor helps you blow up on social media, opens doors for speaking gigs and all of these things. And physicians, I think we've been caught in this space of, well, I'm not the expert, or I don't want to promote myself, or I don't want to put myself out there. It was Larry Winget who was talking about it. He says that we should exploit our giftings, our potential in the service of others. And I think as physicians, we have so much. We have the expertise, we have the experience, we have the network, we have the net worth. We have so many things that are gifts we can give our world, and we should really not shy away from using them. And so I think that's so powerful. And I want to challenge you who's listening to just stop and take inventory. What is my privilege? Like, itemize it and then decide, I am going to exploit this in the service of others. This is what gives our lives unbelievable significance, because we already have it. Like, this is a gift we can give people. We already have it, right? And that was just so powerful. You got me there. So where do people go to follow you on social media where you blow up? Okay, social media, website, tell us the things. Where do we find you?
Well, if any physicians listening are on TikTok, I'm TikTok Trauma Doc. I am going to pivot and do more YouTube content. I can't do Instagram, but I'm Christine Gibson, MD there. My book is at moderntrauma.com, and Amazon in the US actually has it on sale for $14. I've given out probably, if I had to guess, 600 copies of this book. I'm trying to get it into as many hands as possible. I think it's really useful. So that's moderntrauma.com. And then my professional website is christinegibson.net. So Christine with a CH.
Love it. Okay, guys. So second challenge for you is grab a copy of the book. Okay, she's gonna come here, share her story, take you behind the scenes, get you inspired. The least we can do is get a copy of the book. So get a copy of the book for yourself, get a copy for another doctor in your life, and that's part of how you are the change in medicine. So, Dr. Gibson, oh my goodness, I am so glad that I got you on the podcast. I'm so glad that you shared your story. And I'm very grateful for what you do, because you're an example of what is possible for physicians. We can own the things that we're passionate about, and we can change our world with them, and we can monetize that too. We're all about serving and earning. We do both. So thank you for coming to share your story. Thank you for being an example. And yeah, I'm so glad you came on.
Well, thank you so much for having me. And serving and earning, I'm going to tuck that in my pocket. That's amazing.
Oh yes, serving and earning. We do both. We we do both. We lead with service, but we do both. So everyone, this is an episode you want to take. You want to share it with the doctors in your life. You want to get a copy of the book, and you want to take inventory of your privilege, okay? So that you can start using it to serve your world. It will bring so much, such a sense of fulfillment. I mean, like looking at Dr. Gibson, you can see the smile on her face. You can hear it in her voice. It's just like, this is satisfaction, right? This is living a life and you feel like it's really, really meaningful. And like Dr. Gibson has now adopted the phrase, you do all of that in service and you earn at the same time. So go share this episode, and I will see you on the next episode of the Doctors Changing Medicine podcast.